So this part, I'm going to go over some of the gut tube structures and functions and talk a little bit about the function of swallowing. I'm not going to go through the entire gut tube. That's actually meant for 2240, but since we're in the head and the neck part during 2230, I wanted to make sure you guys know these structures, and then they come back again in the next semester. So one of the things you want to see is if we have a sagittally sectioned head here, we're going to have this up here is the nasal cavity. The nasal cavity is actually the opening for the respiratory system. And then underneath, so this is the hard palate right here. So remember, the hard palate is the maxilla plus the palatine bone. So underneath that is the oral cavity. So the oral cavity is the area inside of the mouth. Basically, it's your mouth. And then you can see this is the tongue right there. And then back behind the hard palate, this part that dangles off is the soft palate. Whoa, it's very hard to write sideways. I don't know why I try to do that. And then the end portion of the soft palate, that's actually called the uvula. It's basically that little dangly piece at the back of your throat. So the hard palate and the soft palate close off the nasopharynx from the oral, the nasal cavity from the oral cavity, so that during swallowing, food doesn't get pushed out of your nose, basically. Because inside of the oral cavity where you have the tongue, you don't want to forget here's mylohyoid. Then you have geniohyoid. And then we have genioglossus, which is different than the muscles of the tongue. So the intrinsic muscles of the tongue are the skeletal muscles that make up the actual tongue itself. Okay. Then you have teeth, obviously. And then what you're going to see is that the nasal cavity, which is the opening for the respiratory system, and the oral cavity, the opening for the gut tube, actually have a common passageway. So this part here going all the way down here is the pharynx. The pharynx has different partitions. One is called nasopharynx, the other is oropharynx, and the other one is laryngopharynx. So this is where both air moves and both food moves. So air moves from the nasal cavity through the nasopharynx, oropharynx, laryngopharynx, and then goes anterior through the respiratory tract, which is in the front. Food, however, food is going to go in the mouth through the oral cavity, then the oropharynx, down past the laryngopharynx, and then into the esophagus. This is actually the esophagus right here. So this anterior portion of this tube, basically going from that flap all the way down, this is the larynx. And then the tube below that, or inferior to that, this is the trachea. So trachea is where air should go, and the esophagus is where food should go. I mean, that's everybody knows that, right? This flap on the top of the larynx, this is the epiglottis, which if you look down the throat enough, you can actually see that little flap dangling upwards, okay? So the purpose of the gut tube is for food to move through it, but the problem is we have an anteriorly situated airway tube. So we want to make sure that food actually doesn't go into the airway when you swallow, that you purposely move food into the esophagus, which is the dorsally or posteriorly situated tube. So I'm going to show you a couple like animations here where we can see what's happening during swallowing. Okay, I might annotate them a little bit since I couldn't kind of do it in class. You're gonna see there's the food, right? The tongue is gonna push the food here back up against the hard palate. The soft palate closes off right there. Food goes into the oropharynx and then gets pulled all the way down past the epiglottis, which flaps over. And then you see that food passes into the esophagus down below. And then we can see here's this other video or like animation again, where food is going to be passing through the oral cavity. It goes past the epiglottis, which is this like kind of, it's actually a cartilage flap that is a little bit more elastic because it's actually made out of elastic cartilage and can fly back and forth up and down so that that food can actually pass through back behind the trachea, which is in the front right here, into the esophagus back behind it. So I'm going to remove those things and you guys can play around with them when you get, if you download this PowerPoint. And I'm going to kind of reposition my video here and I'm going to go through the steps of deglutition, okay? So one, you're going to have the buccal phase. And I'm not going to go into detail. You still have to study this. I'm just going to tell you in the buccal phase, what are the things you have to do? You have to put food in the mouth. You have to chew that food. So you want to think about when you're chewing food, what muscles do you use? What is the innervation of those muscles? Go back and look at that video that I did about chewing muscles and their innervation. You chew your food, okay? That food, when it gets manipulated, you're going to use your tongue to manipulate the food and you push it back towards your front part of your teeth. You chew it more and you grind it. And then you push it upwards. So you're going to push the food upwards towards the hard palate. The soft palate is going to contract because of cranial nerve number 10 as a result. We're not going to forget, we're going to have saliva. So saliva is meant to help moisten the food and also help start to break down carbohydrates in our mouth. Because food is made up of different organic compounds, and you have to break them into smaller pieces in order for them to be absorbed by the stomach. The way you break down large-scale carbohydrates, or what are called complex carbs, is first in the mouth using saliva. Sorry, I was just thinking about one of my exam questions for another class. So we're going to have saliva production. We're going to have food manipulation. Basically, you're going to have tongue muscles move food to the oropharynx. So all of that has to be done by those tongue muscles that I covered, right? And what they're innervated by. So those tongue muscles push up, the soft palate closes, which is innervated by cranial nerve number 10, moves, and food ends up going into the oropharynx. That's our buccal phase, okay? The pharyngeal phase is next. In the pharyngeal phase, all the stuff that happens basically in the oropharynx and the laryngopharynx in order to move food into the esophagus. So in this case, you now have to start contracting pharyngeal constrictor muscles. Plus maybe stylopharyngeus. Sorry about my spelling over there. Stylopharyngeus muscle. Yeah, I'll rewrite that. Because remember, the stylopharyngeus muscle also is helping us elevate the pharynx. So as you do that, the superior pharyngeal constrictor, which is roughly right about here, contracts, and then the middle pharyngeal constrictor here contracts, and then the inferior pharyngeal constrictor contracts as well. What this means is the muscles in the neck that help us elevate the hyoid have to move. This is going to help us move the epiglottis down. Oops. And that's going to cover the larynx. This way, food ends up in the esophagus. Or basically, food moves to the esophagus. Then the third part is the esophageal phase, which I kind of forgot to put on my lecture. Hopefully I've amended that since, but I kind of forgot to put that on the lecture where essentially the smooth muscles in the pharynx contract. I'm sorry, the esophagus contracts. And food moves all the way to the stomach. So that's also going to be done by cranial nerve number 10. Okay, so cranial nerve number 10 is going to innervate a lot of stuff. And remember, cranial nerve number 10 has parasympathetic innervation, which means that it's going to do rest and digest, which means it does everything for digestion. So swallowing, and then all the stuff in terms of like once you've eaten something, it's going to help move all of your intestines, your stomach, and like push everything forward, basically. Okay, so those are our nice steps for gut tube functions. Let's go over respiratory tube functions in another, hopefully not too long video.